Hello everyone! Today we will discuss about the schizophrenia spectrum disorders, which consists of schizophrenia, schizophreniform disorder, schizoaffective disorder, and delusional disorder, which are defined by one of the following main symptoms. Delusions are defined as fixed, fake beliefs that conflict with reality. A person in a delusional state cannot let go of their convictions. Hallucinations are sensations that appear to be real but are cheated within the mind. Example include seeing things that are not there or hearing voices. Disorganized thinking, typically from the individual's speech. For example, an individual may give unnecessary details in response to a question before they finally produce the desired response. Abnormal motor behavior. These behaviors may manifest as awkward movements or even repetitive behaviors, impacting their ability to perform daily activities. Catatonic behavior is a marked decrease in reactivity to the environment. People with catatonic symptoms in schizophrenia exhibit unusual styles and levels of physical movement. Negative symptoms defined as the inability to initiate actions, speech, express emotions, or to feel pressure. Individuals diagnosed with a schizophrenia spectrum disorder experience a psychosis, which is defined as a loss of contact with reality. Psychosis episodes make it difficult for individuals to perceive and respond to environmental stimuli that causes a significant disturbance in everyday functioning. Now, let us discuss the schizophrenia spectrum disorders. Schizophrenia is a serious mental illness that affects how a person thinks, feels, and behaves. An individual with schizophrenia may seem like they have lost touch with reality, which causes significant distress from the individual, family members, and friends. The presence of symptoms have to persist for a minimum of 6 months to meet criteria for a schizophrenia diagnosis. These symptoms create significant impairment in an individual's ability to engage in a normal daily functioning, such as work, school, relationship with others, or self. Schizophreniform disorder. This is like schizophrenia with the exception of the length of presentation of symptoms. Schizophreniform disorder is considered an intermediate disorder between schizophrenia and brief psychotic disorder, as the symptoms are present for at least 1 month but no longer than 6 months. Schizoaffective disorder is a mental health disorder that is marked by combination of schizophrenia symptoms and mood disorder symptoms such as depression or mania. Delusional disorder, previously called paranoid disorder. People who can't tell what's real from what is imagined. Delusional disorder requires the presence of at least one delusional that lasts for at least 1 month in duration. Unlike most other schizophrenia-related disorders, daily functioning is not overly impacted due to the delusions. The DSM-4 APA 2013 identified 5 main subtypes of delusional disorder to better categorize the symptoms of individuals' disorder. Number 1. Erotomatic delusion. Number 2. Grandiose delusion. Number 3. Jealous delusion. Number 4. Persecutory delusion. Number 5. Somatic delusion.
Etiology. First, biological. Under biological etiology are family or genetic studies, neurobiological, and stress cascade. Second, psychological. Under psychological etiology is the cognitive. Third, sociocultural. Under sociocultural etiology are expressed emotion and family dysfunction. Treatments. Psychopharmacology. Among the first antipsychotic medications used for the treatment of schizophrenia was Thorazine. Developed as a derivative of antihistamines, Thorazine was the first line of treatment that produced a calming effect on even the most severely agitated patients and allowed for organization of thoughts. Psychotherapy, cognitive behavioral therapy or CBT. The goal of this treatment is to identify the negative biases and attributions that influence an individual's interpretations of events and the subsequent consequences of these thoughts and behaviors about their disease, the course of their symptoms, challenging and replacing the negative thoughts or behaviors to more positive thoughts or behavior. Family intervention. Family intervention have been largely influenced by the diathesis stress model of schizophrenia. As previously discussed, the emergence of the disorder and or exacerbation of symptoms is likely related to environmental stressors and psychological factors. Therefore, the overall goal of family interventions is to reduce the stress on the individual that is likely to elicit onset of symptoms. While a combination of psychopharmacological, psychological, and family intervention is the most effective treatment in managing schizophrenia symptoms, rarely do these treatments restore a patient to pre-morbid levels of functioning.